Hi, I'm Dr. C. Gary Taylor. Today I wanted to talk to you a little bit about low back problems. This is a common complaint that we see in our office, and one of the things that we want to do is to show you what's happening when you're having a disc problem. Most people understand that if they're having problems in their low back, that pain can go down into their legs, one leg or both legs, depending on the area of involvement. The thing that most people don't realize is that when they're having this problem with pain in their low back is that the organ system is also being affected at the same time. It can compromise bladder, leaky bladder problems, colon problems. It can contribute to constipation or diarrhea. Sex organs can also have a problem with prostate, or in females can cause painful periods, even problems with the ability to be able to have children because of the nerve interference that's going on there. So a lot of different things that can compromise that, and a lot of different things that we're looking at when we're treating somebody. So it's not just about the area of pain that's necessarily, because we can have referral pain that creates the problems going down the leg, which we know can also compromise problems with the feet, the knee, the hip, can all contribute to the low back problem. So we need to look at multiple components of the problem and not just look at one thing that a lot of times doctors, therapy, different things that look at. In chiropractic, what we're looking at is called the subluxation. That's where we have mobility in areas of the spine, and then we have an area of restriction that's up the spine. So as a chiropractor, what we're wanting to do is be able to get that mobility back into the joint, create nice flexibility and mobility of the joint, and what we call normal joint motion. Now, the problem is that a lot of times the people, because they have normal motion as far as when they're bending, they think they have normal motion of the joint. And nothing could be further the truth, because we know that the other areas of the spine will compensate for an area of injury and be able to move around there. So it's normal motion of each of the segments that we're looking for, not just normal motion in part areas of the spine. Most people don't realize that there are different stages of degeneration. Okay, this is a normal spine. We have normal disc space, normal nerve, normal as far as the spinal cord, no impingement there, nice mobility in the joint. And movement of the joint is critical to joint health. It helps us to be able to get nutrients in, get water or fluids into the area, helps us get waste products out of there, and then in as little as 10 days, science has shown us that we can start degenerative changes. That's the reason why we're so important on having patients to be able to try to get on a maintenance level care, depending upon what kind of condition their spine is. When they come in here is going to determine what level of maintenance they need. Even though we have a normal spine segment here, this first stage of degeneration takes 7 to 10 years to show up on an x-ray. It can be accelerated, the amount of degeneration that we have, based upon the trauma that's placed upon the spine. So when we have multiple injuries, auto accidents, falls, things like that, all of those take their toll. But we can also have micro trauma, just day in, day out, things that people are lifting, moving, twisting, turning, creates a breakdown of the disc, creates problems where we have less mobility of the spine, and we have the fragmentation of the disc when it gets dehydrated, starts breaking down. That's another reason why we recommend drinking good Kangen water, because it gets into the cells better, hydrates better than your natural water from the tap. The next stage takes 10 to 15 years, where we have degenerative changes that are taking place of the bone at this point, where we're seeing that the disc is worn down and we're getting spurring of the bone. This is what most people term osteoarthritis or degenerative joint disease at this point. more degenerative changes taking place in the nerve, as well as the disc and the spinal cord, you're more likely to have a herniation. Last page, 25 to 30 years, which we want to always try to prevent someone from going to this stage. At this point, the disc has completely gone away, the area is fused together, the body's trying to fuse that, so you put more stress on the next joint. This is also what happens when surgery occurs, is that you increase stress loads on the spine in another area. So I want to encourage you to take good care of your spinal health, and we're offering you an opportunity to be able to come in, get your spine checked if you're having a problem, or even if you're not having a problem, preventative care. Come in and get your spine checked with us. We'll be happy to be able to evaluate you and let you know the status of your spine. Thank you.